Hi, hello everyone. Welcome to discussion of RGUHS August 2024 Biochemistry Paper 1. Okay, let's start with the long essays, then short essays, then briefly about the answers of short answers and the MCQs. Let's start with the long essays. The long essays, the long essay number 1, that is about diabetic ketoacidosis. Okay, diabetic ketoacidosis. As you know, disorders of acid-base balance is a repeat question, very commonly asked in the exam. Let's see what are the questions asked. What is acid-base disturbance of the above patient? Okay. Mention the normal pH. Explain the renal mechanism of acid-base balance. Leads to other clinical condition causing above acid-base balance. So this is asked in your exam May 2023, June 2021. Let's see briefly about the answer. As you know, metabolic acidosis can be high anion gap acidosis or normal anion gap acidosis. High anion gap because of the acid retention. What are the condition? Ketoacidosis, lactic acidosis, renal failure, salicylates, methanol, ethylene glycol. Normal anion gap acidosis basically because of bicarbonate loss. The causes are diarrhea, acetozolamide, ureteroenterostomy, renal tubular acidosis, excessive intravenous fluid replacement. Okay, this you need to write for this question D. Then one more question asked about the active site of enzyme. What are the salient features? So probably this is 4 mark and this is probably 6 mark. Active site. The active site, the salient features as mentioned in your standard textbook, you need to write these answers. They are due to tertiary structure of the protein resulting in three-dimensional native conformation. Active site is made up of amino acids known as catalytic residues. They are regarded as clefts. Active site is not rigid structure, rather it is flexible. Active site possesses substrate binding site and catalytic site. The coenzyme or cofactors or some enzymes depend are present as a part of catalytic site. So all this you need to write to get full mark. And also you need to write about the enzyme inhibition from the standard textbook. Reversible, irreversible and allosteric inhibition. So if you write these points in your exam, you will get good mark. Then coming into what are the factors affecting enzyme activity? Temperature, pH, enzyme concentration, substrate concentration. Classification of enzyme is a repeat question. And also example for competitive inhibitors also you need to write in the exam. Next comes is the short essays. Short essays, most of them are repeats. If you see here, vitamin D, repeat question. The question number 3 is about vitamin D, repeat question. Question number 4 is iron. Repeat question in May 2023. Gluconeogenesis. Repeat question in May 2022. Lipoprotein. Main question asked in your Feb 2021. HDL is known as a good cholesterol. LDL known as bad cholesterol. That is also asked in your exam. Dietary fiber asked in your Feb 2024. Well-fed state and starvation state. Both are repeat question in May 2023. Riboflavin. Basically the coenzyme, repeat question. Lastly, pentose pathway and uronic acid pathway, repeat question from November 2023. So all 8 out of 8, they are almost repeats from previous years. Now coming into short answers. Define symport and antiport with one example each. Symport, as you know, it is a type of secondary active transport. There is a transport of two different molecules in the same direction through the cell membrane. So symport means same direction. The example is sodium glucose symporter. Antiport, where there is a transport of two different molecules in opposite direction. Opposite direction. Example, sodium hydrogen antiport. So if you write the definition, you will get 3 out of 3 along with the examples, and rest all also you can write in your upcoming exam. Secondary active transporter can be symporter, antiporter. This diagram you can write in your exam. Explain structure of collagen. Repeat question from your previous year. Structure of collagen. So this is the structure of collagen. Consists of these amino acids: hydroxyproline, proline and glycine. It has 3 distinct polypeptides of amino acids. Alpha helix pattern. So it is an alpha helix pattern, consists of 3 important amino acids: glycine, hydroxyproline and proline. There are different types of collagen. Type 1 is the abundant collagen present in the bone, skin and tendons. What are disorders is the question asked. It can be Ehlers-Danlos syndrome, Alport syndrome, osteogenesis imperfecta, scurvy, letharism. All these are the abnormalities associated with collagen synthesis. So any 1 or 2 if you mention along with the collagen structure, you will get 3 out of 3. Can anyone identify what is this condition A and what is this condition B? You just type in the comment section in YouTube. A and B. How sugar alcohols are formed? Mention the clinical importance of sorbitol and mannitol. Sorbitol, you know, it is involved in diabetic retinopathy. Sugar alcohol or sorbitol is found when glucose is reduced. Reduction of galactose can lead to dulcitol. Fructose can lead to mannitol and sorbitol. So this is diabetic retinopathy, a diabetic cataract, that is because of the sorbitol. And what is the enzyme involved? You need to mention in the exam aldose reductase enzyme. And the second step in sorbitol pathway, that involves sorbitol dehydrogenase, where there is a conversion of sorbitol into fructose by the enzyme sorbitol dehydrogenase. And remember the sorbitol pathway, it's a minor pathway. It associated with many complications in diabetes mellitus. What are they? Neuropathy, nephropathy, retinopathy, and also formation of cataract, because sorbitol cannot cross the cell membrane. So when it builds up, it causes osmotic stress on cells by drawing water into insulin independent tissues. So this is the importance of sorbitol. And what is the importance of mannitol? So this is the mannitol, and this mannitol is used in many conditions: head injury without cerebral hemorrhage, acute congestive glaucoma, and also the stroke. It is given IV because it is not absorbed orally. It is minimally metabolized, freely filtered in the glomerulus. If you mention these points, you will get 3 out of 3 in upcoming exam. It is contraindicated in acute left ventricular failure, pulmonary edema, congestive heart failure, cerebral hemorrhage, renal insufficiency. Question number 14. How liposomes are formed? Clinical applications of liposome. It's a new question. Liposomes, they form by many methods. One is hydration, microfluidics, detergent removal. There are many methods. You can see here there are many methods of liposome formation. What are liposome? They are simple microscopic vesicles in which an aqueous volume is entirely enclosed by membrane composed of lipid molecule. First produced by Alec D. Bangham in 1961 in England. The methods are physical dispersion technique by using fusion method, French pressure cell method, dried reconstituted vesicle, membrane extrusion, solvent dispersion technique by using ethanol injection, ether injection, reverse phase evaporation vesicle, emulsion, double emulsion vesicle, and detergent solubilization technique. If you mention any 3, you will get 1.5 mark. And what are the role of liposome? They are used in drug delivery, vaccine carrier, tumor therapy, gene delivery, artificial blood surrogates, and also in dermatology. If you mention any 3, you will get 1.5. It is about the liposome. Lipotropic factors. It's a very simple question, repeat question. What is lipotropic factor? They are substances who facilitate mobilization of fat, prevent accumulation of fat in liver. So this is the definition of lipotropic factor. They prevent accumulation of fat in the liver. What are the examples? Choline, betaine, methionine, essential fatty acids, inositol. If you mention this, you will get 3 out of 3. Deficiency of this causes fatty liver. What are high energy compounds? Examples and importance. High energy compounds are those which on hydrolysis give rise to free energy equal to or greater than that of ATP. That is more than 7.3 kilocalories per moles. Less than that, they are known as low energy compounds. They are classified into many types. Pyrophosphate, example ATP and pyrophosphate. Acyl phosphate, 1,3-bisphosphoglycerate, carbamyl phosphate, acetyl phosphate. Enol phosphate, example phosphoenol pyruvate. Thiol esters, acetyl CoA and acyl CoA. If you mention any 3 with a definition, you will get 3 out of 3. And they are involved in various mechanisms. Like example ATP, that is involved in formation of DNA, RNA, amino acids, polysaccharides. Also involved in muscle contraction. also involved in active transport, secretion, in the formation of lysosomes, and also for the chemical reactions. Biochemical functions of zinc. So one is it is a cofactor for many enzymes. It also for the formation activity of zinc finger proteins. So in exam you need to mention functions of zinc. Other functions are cellular function, growth and cell development, cell membrane integrity, tissue growth, wound healing, and also for the function of neutrophil, T cell, B cell and NK cells. This is the one clinical condition due to zinc deficiency known as acrodermatitis enteropathica. Enteropathica. Now comes is the define obesity, mention health risk of obesity. What is obesity? According to WHO, when body mass index is more than 30, that is known as obesity. And obesity is because of excess of body mass or fat accumulation in the person's body, which is known as unhealthy condition, can lead to many health risk. So this is obesity. Obesity classified into class 1 obesity more than 30 BMI, class 2 up to 39.9, class 4 that is 49.9 which is known as morbid obesity, more than 50 known as super obesity. So obesity can lead to many health risks. Risk of type 2 diabetes because of insulin resistance, can lead to heart disease, basically myocardial infarction, angina pectoris because of atherosclerosis, sleep apnea can lead to sudden death, stroke, it can lead to hemorrhage, secondary hypertension, osteoarthritis, especially involving the knee joint, can prone to cancers, pregnancy issues, other problems. So if you mention any three out of 3 you will get. Define hyperkalemia clinical uses. Hyperkalemia is a condition when potassium level more than 5 milliequivalents per liter. The symptoms develop usually at the level of 6.5 to 7. It can lead to life-threatening cardiac arrhythmias. So hyperkalemia, normal potassium level is 3.5 to 5. Hyperkalemia more than 5. So it can lead to cardiac arrhythmias. What are the causes is the question asked. The causes are basically, one can be insulin deficiency, beta blocker, cell injury, or because of the minerocortical deficiency. If you mention any 3, that is more than sufficient. Name bile salts and its function. See, bile salts can be primary and secondary. Primary and secondary. They involved in the fat absorption. So bile salts can be primary bile acids like cholic acid and quinodeoxycholic acid. Secondary bile acid, example deoxycholic acid, lithocholic acid. The functions are, they involved in cholesterol excretion as a metabolic products of cholesterol, solubilizer of cholesterol in the bile, emulsification of the dietary lipids, cofactor for pancreatic lipase, and also facilitate intestinal lipid absorption by formation of mixed micelle. If you mention this, you will get 3 out of 3. Then comes is the MCQ. Km value of an enzyme. What is Km value? It is the substrate concentration at which half of the maximum velocity that takes place. So the answer is B is the answer. Deficiency of which of the following vitamins leads to excretion of xanthurenic acid in the urine? Answer is vitamin B6. A is the answer. Secretion of antidiuretic hormone stimulated by all except is there. It can be increased sodium, high osmolarity, ECF volume contraction. So answer is C. Which of the following is heteropolysaccharide? Answer is simple heparin, B. Which of the following represents alkyl reserve? Bicarbonate. Marker of enzyme of organelle lysosome. Answer is acid phosphatase. C. Major fat in adipose tissue. A is the answer. Triacylglycerol. All the following increase the absorption of calcium from intestine except calcitriol, yes. Parathyroid, yes. Basic amino acids, yes. Calcitonin, C is the answer. So calcitonin basically decreases serum calcium level. Which of the following condition associated with secondary hyperlipidemia? Nephrotic syndrome, one of the simple question. Lastly, death due to cyanide poisoning is a result of, it inhibits cytochrome oxidase enzyme. So the answer is A. So what we can see here, both the main questions, they are relatively easy. One is diabetic ketoacidosis. Okay. Both are almost repeats from the previous year paper. All the short essays, they are repeats, 8 out of 8. This is a repeat question. Repeat question 12 is also repeat. This is a new question but relatively simple. Liposome is new. Lipotrophic factor is also repeat question. High energy compound is a new question. Zinc old question. Obesity simple. So almost more than 80% repeats from previous year papers. So there are 80% of the concepts I am telling you, they are repeat from the previous year papers, not the questions. It is the concepts are repeats from the previous year papers. Thank you. Wish you all the best for the upcoming exam.